Welcome back to ESSA TV. Dr. Jonathan Gruber is the Ford Professor of Economics at the Massachusetts Institute of Technology. He is also the Director of the Healthcare Program at the National Bureau of Economic Research and President of the American Society of Health Economists. Dr. Gruber, thank you very much for joining us today.
My pleasure.
You are best known for your contributions to the field of health economics and your involvement in shaping public health policy. Where did your interest in health economics stem from, and how did you find yourself consulting governments on policy?
Well, when I was in graduate school in the early 1990s, healthcare was a very big issue. Bill Clinton made it a major issue in his election. And as a result, it's something I really decided would be interesting to work on for my research. And so I really did a lot of healthcare research, and that's sort of where my academic work came from. My public policy work actually came from a different source, which is that I got involved in building models, what's called microsimulation models, computer models of how government healthcare policies would actually affect real people. And that was very useful for policymakers as they were trying to decide the effects of policies. In the U.S., we have something called the CBO, the Congressional Budget Office, which is an agency which tells policymakers how their policies will affect the deficit and the number of uninsured and other things. But we don't really have objective parties that serve the same function, and that's what I was trying to do.
You were involved in the crafting of both the Massachusetts healthcare reform as well as the Affordable Care Act, known respectively as Obamacare and Romney Care. Can you describe your experiences working on these reforms, and how do you look back on them now, several years later?
Well, at the time, I did not realize at all what a big deal they'd be. So I began working in Massachusetts with Governor Romney. As I said, I had this computer model which would help Governor Romney's team figure out how their different approaches might work. And while at the federal level, we have the CBO, which is this very professional organization to help understand how policies work. At the state level, you don't have anything like that. And so they didn't really have a model they could turn to other than mine. So my model became sort of the mechanism by which the governor's team could explore the costs and benefits of different policy approaches. And so it's sort of, how does a nerd get in the room with these policymakers? The way I did was because I was the guy with the numbers. I think the lesson is that having an important number, an important way to express factually the impacts of government policy still matters, or at least mattered 10 or 12 years ago. And so I did that for the state. And then when President Obama got elected, I knew a bunch of his health policy advisors, and they said, gee, we'd like to use that same kind of modeling exercise at the national level. So they brought me along to work with President Obama and the Congress to do the same kind of modeling exercise for national healthcare reform.
The prospect of a single-payer healthcare system in the US continues to make headlines. One study found that over half of all Democrats now support a national plan for healthcare, and some prominent Democratic senators such as Cory Booker have come out to endorse and co-sponsor a single-payer healthcare bill being drafted by Bernie Sanders. As an advocate of the state of Vermont's single-payer bill back in 2011, what are your thoughts on this latest push for a government-run healthcare system, and what challenges would need to be overcome in implementing such a system nationwide?
I definitely wouldn't count myself as an advocate of single-payer. I worked with the state of Vermont to help them analyze their single-payer proposals. But really, I think there's a lot of pros and cons of single payer from an economics perspective. I'm of two minds on it. But I think politically it's an enormous challenge. Indeed, there was a survey that came out today from the Kaiser Family Foundation, which showed that 60% of people supported single payer until you informed them that their taxes might go up to pay for it, at which point supported fell to below 40%. So I think the problem is a lot of people say single payer is very broadly supported, but the support is not very broad. And I feel like it's still really a very strong political challenge. I don't think it's necessarily right or wrong from economics perspective. I think there's pros and cons. But I continue to think politically, it's just too heavy a lift for the U.S. right now. Look at the battle we just had, and the battle we continue to have over Obamacare, which is very tiny compared to single payer health care. I just don't see how we can line up the support, the really bipartisan support you'd need to make such a major change in the U.S. healthcare system.
You've recently launched a free microeconomics course on edX, a massive open online course provider. What motivated you to develop this online course, and why should individuals who are interested in economics consider enrolling in your course?
Thanks for asking. Yeah, I was very excited. Your generation doesn't know, but it used to be when you get on a plane, you talk to people instead of just looking at your devices. And whenever I get on a plane and talk to people, they'd always tell me how awful their economics classes were. And I always thought, that can't be right. Economics is interesting. It must just be badly taught. And at the high school level, it is badly taught in the US because high school teachers who teach AP economics aren't trained in economics. They're trained in social studies, or sometimes the gym teacher teaches it, or whatever. And they're well-meaning people. I don't mean they're making a good effort. And some high school economics teachers I've spoken to are excellent, but many are not. And many people, not that they're not excellent, they're just not expert in it. They're good people, they're working hard, but it's a hard subject, right? It's hard without economics training to know how to explain it clearly. So I thought I'd provide a resource that would help these teachers actually teach it. And I think it's a resource that can be useful in America and around the world, in Australia and elsewhere. It's in English, so I think it could be particularly helpful in places like Australia. But I'm hoping around the world it can be helpful for people who really want that basic level economics understanding. It's available for free on the edX platform. If you just go to edX and Google AP Microeconomics, AP is the American Advanced Placement Exam, the course will come up. Anyone can take it for free, or I think if you want a certificate, it's like $49 US. But it's I think it's a very clear way to sort of really get a base of economics. And look, if I can be a little, get out what we say in America, get on my high horse and make a speech here. We're at a point all around the world where I feel like there's real threats to democracy. And those threats come not from the right or the left, but from the uninformed. They come from people who are lying, who are not using facts correctly. And your generation, the way to fight that is with the use of the proper scientific method, is with the use of understanding how to understand truth and explain truth. And the point of my course is to help people understand economics, the power it brings, and a way that people can take it, understand it better, and then use it to make more informed decisions in their lives and be more informed voters.
Thank you very much for joining us today, Dr. Gruber.
It's my pleasure. Thanks for having me on.